Hi, my name is Amy Ushry. I'm a senior nurse program manager with the American College of Obstetricians and Gynecologists. This year, one of the items in our scope of work for the Maternal Health Learning and Innovation Center, or MHLIC, was to convene other professional membership organizations so that we could share about what we are each doing to foster diversity, equity, and inclusive excellence among perinatal teams and the professions that our organizations represent. In this session, I'll be sharing more about that virtual diversity, equity, and inclusive excellence convening and some of the preliminary findings and takeaways from our shared learning. This year, in June 2022, the White House blueprint for addressing the maternal health crisis was released. One of the goals in that blueprint was to expand and diversify the perinatal workforce. Although this blueprint was released this year, we know that a lack of diversity in medical professions is nothing new. And we know that structural racism in the medical system has for a long time led to a health workforce that is not necessarily racially and ethnically representative of all the patients served. A few examples of lack of racial and ethnic diversity in the workforce include the fact that although roughly half of all births in the United States are to birthing people of color, fewer than 1/5 of obstetricians come from underrepresented racial and ethnic communities. Also, in 2016, just 5.8% of certified nurse midwives or certified midwives could be identified as people of color. Other studies have shown that although in the past 10 years, there has been an increase in the proportion of people of color in the total healthcare workforce, when they've looked at that data closer, it reveals that the majority of people of color in healthcare jobs remain in entry-level and often lower paying jobs with less opportunity for advancement. In addition, just having a more diverse perinatal health workforce is not enough. We know that it's important not only to have diversity, but to foster an inclusive environment such that people of color in the workforce are not met with hostile work environments, racism, little room for advancement, and a lack of support. We also know that fostering diversity and inclusive excellence within perinatal healthcare teams doesn't just benefit those providers and staff, but it can also allow for more culturally congruent care. It can help mitigate cultural barriers within the healthcare system and more. And some studies have shown that for people from minority racial and ethnic groups, racial concordance between the physician and patient can increase rapport and potentially even improve outcomes in some cases. So what role could ACOG play in working on this goal? As the premier professional membership organization for obstetrician gynecologists, we represent over 60,000 members. We also have longstanding relationships with other professional membership organizations, and we've made an organizational commitment to creating a diverse, equitable, and inclusive culture of excellence. Because of this connection to the perinatal health workforce, we felt a responsibility to learn together with other member organizations for a time of sharing within the virtual diversity, equity, inclusive excellence convening. In planning the convening, there were several factors we needed to think about. First, we wanted everyone to understand that organizations would be in different stages of their efforts, and we wanted everyone to be comfortable sharing authentically about their work, even if the answer was that the organization might be just getting started or learning. We understood that all attendees would be working from different definitions and organizational structures, which impact their own unique approaches and decision-making. And we also wanted to acknowledge that professional organizations can and should use their influence to impact change. However, professional organizations are typically not licensing boards, and they typically don't have certain powers such as legislating policies for individual providers, hospitals, and clinical settings. For the convening, we had attendees from 11 organizations participate. These organizations included groups representing nurses, physicians, women's health nurse practitioners, certified nurse midwives, family physicians, maternal fetal medicine specialists, and boards. All who registered received a pre-convening matrix to fill out so that we could make sharing more streamlined on the day of the convening. We're still going through all of the notes and matrices from the convening and plan to include our final findings in a full report, but we did want to share for this session a very high-level summary of some of the efforts taking place. Most of the organizations reported efforts that are shown on this slide. Most had started with or were getting started with efforts that focus on leadership and boards. And this ranged from a structured focus on diversifying boards of directors to DEI-focused learning journeys for boards and leadership. Most were also doing or had completed some sort of assessment or survey of members, as well as of staff, boards, and other stakeholders to inform the development of a strategic plan. Within those strategic plans, one of the pillars that we saw most often was member education with a focus on implicit bias and anti-racism training. That was typically found throughout all of the organizations. Also, we found that most of the plans included a mixture of internal staff-facing efforts as well as workforce-facing strategies, which is what we expected to see given the interrelatedness of fostering DEI throughout. Most groups had also developed and released formal statements and commitments to DEI and had formed task force, with a few even adding additional positions devoted completely to DEI goals. Moving to some of the strategies that were included in some, but not all of the matrices, it was great to see some student-focused initiatives with plans such as task force specifically focused on racism in professional education, plans for work on program content, school policy guidance, and preceptor education. There were organizations working on leadership pipelines that promote committee membership amongst diverse groups, as well as groups that were looking to embed DEI principles in their committee membership applications. One organization had developed an award for extraordinary mentorship in DEI. We also saw organizations having member-driven community groups for members who wanted to join communities based around their racial and ethnic identities and receive support from there. We also saw organizations auditing their documents and resources to identify areas that need to be changed in those, as well as engaging in targeted listening sessions with members from underrepresented racial and ethnic groups in order to better understand needs, perspectives, and experiences. Overall, we received a lot of feedback that groups would like to continue sharing and learning moving forward, but we did identify a few themes that were shared with us that we could delve into further. First, people wanted to be more intentional around driving home the message of why this work is crucial, and that when perinatal workforces are not inclusive, everyone loses because we lose the talent, skills, and gifts of those that are being excluded, and patients lose. Finally, highlighting that DEI work is everyone's shared responsibility and not just extra labor for people from underrepresented racial and ethnic groups. In conclusion, we'll be continuing to look at the notes and matrices, and we look forward to having a full report by the end of September 2022. We have identified some areas for growth that we've shared on this slide, including expanding ways of listening to members beyond the surveys and listening sessions that are already happening, exploring more ways to bridge the clinical and community spaces to partner with community groups on these efforts, exploring evaluation strategies, and more. So I do, in conclusion, want to thank the MHLIC for supporting this convening and providing us the opportunity to share. I want to thank the ACOG staff and leadership who supported this convening. And I want to thank all of the organizations for their commitment to this work and their willingness to share with each other as we all seek to foster a more diverse, equitable, and inclusive perinatal health workforce. Thank you so much for listening and have a great day.